Hello everybody, welcome back to Wednesday Wisdom. Thank you for joining us this week. I am so excited because this week I'm going to introduce you to my friend Dr. Karan Lal. Dr. Karan Lal is a double board certified celebrity dermatologist. And today we're going to talk to you a little bit about acne, the different types of acne, how to care for it, and when to get help from a dermatologist. This is a very exciting week because tomorrow on June 16th, we're going to circle back and have a live one-on-one session at 6 p.m. Pacific Standard Time. Dr. Lal is going to join us and we're going to talk to you about whatever you want. It's your access to free special care. You're not going to want to miss this opportunity.
Hey everyone, thank you Lindsey for having me on your segment. So I wanted to talk to you about the types of acne because it's Acne Awareness Month. So for those of you that don't know, there's many different types of acne. There's acne that's called comedonal, where you get mostly blackheads and whiteheads in the oily parts of your skin. There's also something called inflammatory acne, where in addition to blackheads and whiteheads, you get red bumps on your skin. Then there's nodulocystic acne, where you get painful nodules and cysts that often results in scarring. Lastly, there's a type of acne that people often misclassify as fungal acne that's called Piterus folliculitis. That is a yeast acne. This is a yeast that lives on our scalp, and in people of oily skin, you get these skin-colored bumps on your forehead, and they're often mistaken as blackheads and whiteheads that just can't be extracted. That's Piterus folliculitis. It's very important to know what type of acne you have so you know which type of treatment to seek out. There are some great over-the-counter treatments that you can look for basic forms of acne. The first being benzoyl peroxide wash. There's a number of different companies that make benzoyl peroxide washes, including CeraVe, La Roche-Posay, and Panoxyl. There's many others, just look what's in your budget. You want to look for something that's around a 4 to 5%, and you want to look for a creamy cleanser so you're not over-cleansing your face and drying out your skin. This works well for bacterial acne and yeast acne, and you want to use this in the morning. Another important thing to remember is you want to look for a topical retinoid, not a retinol. Retinols are great for anti-aging, but when you have acne, you really need something that's going to dry you out and also, decrease your sebaceous glands from overproducing a lot of sebum. So a lot of the generic over-the-counter brands, the generic is called adapalene. There's a lot of different companies, including La Roche-Posay and Differin, which have their own version of adapalene. And this is something that you can use in the morning or at night because it's photostable, meaning it does not get degraded by sunlight. You take a pea-sized amount and apply it to all over your face. Initially, your acne may get worse before it gets better because you're going to purge. These two treatments are great for whether you have bacterial or yeast acne. However, if you're somebody that just wants to do one thing and you have the Piterus folliculitis, one of the best things that you can look for is a jock itch cream, something called clotrimazole. You apply it twice a day to those areas and it will help clear up your yeast acne. This should get better as you get older. Sometimes when people are going through puberty, they're more prone to getting this yeast type of acne due to the hormones that are being produced. You also have to, make sure that you're not over cleansing your skin and moisturize. Even if you have dry or, oily skin, you need to moisturize and you need to wear sunscreen because if you have acne and you have acne scarring, the sun will make that scarring much worse. So you want to make sure you want to look for a sunscreen that is non-comedogenic and use it every morning, especially if you're using these products because they can make you more sun sensitive. Now, when do you seek out a dermatologist for professional help? When over-the-counter treatments are not working after a trial of 3 months. If you have extremely painful nodules or bumps on your face where you may need injection treatment or you may need a discussion of Accutane for treatment. If you have scarring. Once you have scarring is not good. Scarring is very difficult to treat. Even if we have the best lasers that we have, we can't get rid of acne scars 100% of the time. So if you have scarring, it's time to see a dermatologist. Where can you see a dermatologist? You can often look for dermatologists in your area. You can look on ZocDoc, which is a great resource. You can also look for dermatology residency programs, where basically you're going to get to see 2 doctors for the price of 1. You're going to see a doctor in training, such as a resident, and a supervising provider. Sometimes they can provide you the best type of care because they're the most up-to-date on knowledge. And also for people who are uninsured, they can be an easy way to get access because there's a lot of resident clinics where you can get help. Thank you so much, Lindsey, for having me. Make sure you check out our live and come with questions that we're going to answer together. If you have any questions, you can reach out to me at Sir Germs a lot. Thank you so much and have a good day.
Skin is the largest organ in the body. It is a living, breathing creature. It's also the first line of protection against infection. So it's really important that we protect the barrier of our skin. Just like I mentioned last week about dental care, a skin infection can cause problems for the entire body. I also want to tell you that a lot of you have employee benefits for free FSA and HSA programs. I just got $500 free money for completing wellness activities through my employer. I want to thank you for tuning in every Wednesday. I want you to come back here because this information is going to help you or somebody you love. And if you're with us and you're following me, you're going to get the opportunity to go live with us on every Thursday. Those Thursdays, I'm going to offer you access to specialists and care, things that you may not be able to get, in a quick turnaround. I have a radiation oncology specialist who's going to be joining us and coming back to give you a live as well. And then I also have a pharmacy doctor who's going to tune in with us and make sure that you know some tips and tricks about how to get affordable access to healthcare. I really hope that some of this information helps you. I am so passionate about helping people get better access to care. If there's something that you want to hear about or you have a question and you want to hear a special Wednesday wisdom about that topic, send me a message. I'm so excited to hear about what you want to learn about. I read those messages and then I'm out there reaching out to people so we can get you better access to care and resources. I hope you're following us and I hope you're getting the opportunity to join our lives on Thursday. I am so excited about what I have in store for you.